So I'm making this quick video while I make my ginger tea right now because I want to actually talk, maybe this won't be a quick video, I don't know, about a topic that I actively avoid talking about because I hate it so much. And that topic is the U.S. Department of Veterans Affairs, specifically Veterans Health Administration. Just a topic that just won't stop, ever. Anyway, so for years, I've had to deal with Veterans Health Administration on some level. I used to work there. It was a total nightmare. I wrote a book about it called Veterans Affairs Whistleblower Retaliation. It's on my website, vanessaselect.com. And I've kind of dealt with the organization hit or miss. I've tried to get some healthcare out of it. I have very low expectations of the organization, to be clear. I'm not delusional. I don't think that they're actually going to do their jobs all the time, or that the healthcare is going to be particularly the best. Like, my expectations are super freaking low of the organization, and even then they can't measure up. And why I'm getting on this video, though, is because I read last night, because I was doing some research and I was hoping that I could find some information about the topic that I've been thinking and talking and writing about for years, and that is basically freeing military veterans and their families that are eligible for health care from Veterans Health Administration, meaning that they would be able to choose where, when, and who provides their health care. Veterans Health Administration, for those of you that don't know, are robbing the taxpayers in our names, saying it's for us when in fact it's to line their pockets, it's to make their facilities more glitzy, it's to give them better offices, it's to give bonus monies to managers, it's to pay regular paychecks to people who probably wouldn't be employed, quite frankly, if it wasn't for this organization. And if they were, even the doctors and the nurses, a lot of them wouldn't be making the money that they're making. They might not even be working in their occupations, because there's a real issue with quality control at Veterans Health Administration with the people they're hiring. It's only getting worse. They're not hiring the best and the brightest. So this is like over here, I'm just going to start calling out names at this point of facilities. Spartanburg, South Carolina, community-based outpatient clinic is like some third world healthcare situation they got going on over there. You can check out their Google business listing, and I put a review on there with a lot of details and updates just recently. And other veterans have as well. I mean, they're just going for straight 1-star service across the board. And the behavior of a lot of these people that work in Veterans Health Administration is unethical from licensing boards' perspectives and illegal. Now, licensing boards are a whole nother topic, and good luck getting them to hold up the standards, because in America we have all these regulations, but they're typically for the people who are creating them, their benefit, not for the public, despite what they claim. And there's just a lot of illegal stuff, manipulation of wait times, denying veterans health care under the VA Mission Act 2018 so they can get timely health care out in the community. Most people don't understand this topic that talk about it, so they've actually been against veterans like myself getting health care outside the Veterans Health Administration because they don't know what they're talking about. They have no idea. But Veterans Health Administration only wants to keep us a hostage there so they can keep raking in the money. That's basically their bottom line. And there is a couple of politicians, one of them's out of Tennessee, and even though I don't intend on voting Democrat or Republican ever again, because after the shutdown is just my final straw with these awful politicians, I will say that if any of these politicians can pull off and continue to push through the legislation I'm about to talk about, then I would absolutely vote for that person regardless of political party. So basically the legislation would make it to where veterans have complete options, complete choice about where they get their health care. They'd no longer be stuck with Veterans Health Administration. So the legislation would allow, essentially, in a nutshell, because I could go on about this forever, the veteran to go online, schedule their appointment, whether they want to go inside the VA or outside the VA. And the VA, Veterans Health Administration, would no longer have any say-so on how that happens. So right now, they can interfere, deny, delay healthcare for veterans and block access to going outside the healthcare system, even when the veteran qualifies, and to lie and make false statements, manipulate, and try to control the narrative to prevent military veterans eligible and their family members from going outside VA for healthcare to get their healthcare needs met. this is happening to me right now, and it's not the first time. It's definitely been taken up several notches, but basically the Spartanburg, South Carolina community-based outpatient clinic, they have staff there, to include licensed staff, I'd like to mention, which is highly unethical with licensing, where it's highly illegal behavior, by the way. But they're doing it anyways. That's what they do at Veterans Health Administration, that are making false statements, putting this in my the medical record, and claiming that I don't qualify. They've delayed. I've never been able to get an appointment timely at all. You're supposed to, for primary care, feel free to check the law, but for VA Mission Act 2018, you're supposed to be able to get a primary care appointment within 20 days. So that's less than 3 weeks. And if they can't, they're supposed to offer you community care. If it's specialty, it's supposed to be 28 days. Check the law, double check, fact check what I'm saying. But if they can't, they're supposed to offer you a referral out. They did not do that ever. This is typical, the typical practice, method of operation, MO, of Veterans Health Administration to do this. They do this because of the money. They want to, the dollars are attached to the veterans. So they want to control the veterans, even if the veteran ends up dying because of this, even if their health care ends up taking a deeper dive because of this. Because at the end of the day, hear me when I say Veterans Health Administration hates veterans. They hate veterans. They don't care about veterans. They don't care about their family members. They only care about keeping you around so they can squeeze tax money out of you. That is what this is about. The Spartanburg, South Carolina community-based outpatient clinic is no difference. And so I was trying to get some just basic stuff taken care of to basically supplement my healthcare. I'm paying 100% out of pocket for specialized healthcare at this point, for all kinds of things, basically. And that's why I've started this thing called Travel with Vanessa Leck. It's a totally different thing that I'm doing. I've got on YouTube and TikTok and Instagram, and I'm sharing basically a lot of things about healthcare, and I'm going out of the country for healthcare. Started last year, actually in 2024, and I have basically transitioning myself outside the US because of these issues, because the maltreatment I've experienced in the US is so severe, particularly from Veterans Health Administration. Both when I worked there for a couple of years, and was almost about a decade ago, as well as a veteran. And it's not sustainable for me to be paying these sky-high fees for healthcare in the US for things, and to be fighting for healthcare all the time at Veterans Health Administration. And the healthcare systems in America are trash overall, let's be honest. And Veterans Health Administration is just one more aspect of that. The Department of Defense also has issues. It's riddled with medical malpractice and cover-ups. Thank you, Defense Health Agency, for leading the way on that. Now I know they're called something else, don't even care. They want to rename themselves, whatever. Department of Defense, Department of whatever, I don't care. But Veterans Health Administration, the law that's pending, I will do a post about it on my YouTube, and I'm actually probably going to try to write an article about it, or do an article on my website as well, mentioning it, because it's worth mentioning. I don't think it's going to get passed, unfortunately, because as you can see with the government shutdown, these politicians can't agree on a damn thing, and they're all about themselves. They clearly don't care about people. They don't care about their citizens. They don't care about the military population. You know, it's just a terrible situation what we have going on in the U.S. government. It's so bad. It's so embarrassing. As a citizen, it's so bad. And but this law, I'm hopeful that one day, for the sake of all the other veterans who are stuck in this country, seeking health care and fighting for health care that they shouldn't have to fight for, and their family members, I'm hopeful that the law will eventually pass, and it will allow veterans to bypass the Veterans Health Administration altogether to get the health care that they need, because it will be life-saving for many of these veterans and life-preserving. And right now, just like the Spartanburg, South Carolina community-based outpatient clinic is a clear example of what's going on all across the country in most of these VA facilities. Unethical, illegal, rampant behavior to keep the tax money and to harm the veterans. And that's what they're doing. I also have a situation too where this is the first time, and I've dealt with a lot of crazy things. You know, I worked in the healthcare industry for many years of my adult life previously. And I've seen a lot as a patient, as a provider, but what I've not seen is licensed providers trying to hide and conceal the identity of other providers so that patients can't have the information to possibly report illegal behavior or unethical behavior. I've never seen that before. And I'm seeing that Spartanburg, South Carolina community-based outpatient clinic. I've got documentation of it at this point. Don't know if they're going to cooperate with providing the healthcare credentials of the supposed doctor involved in denying me healthcare. But I've contacted the South Carolina Medical and Nursing Board and requested assistance with identifying these people. I don't think they're licensed in South Carolina. This nurse and this doctor, I have limited information on the doctor, but I know how to do some research. And I did look it up, and there's no sign that either one of these individuals are licensed through South Carolina's Medical or Nursing Board. So when you work at a federal facility, you can be licensed in one or more other states, and that's legal under federal law. Feel free to fact check that. And so I need to figure out where they're licensed through, because absolutely I'm going to be reporting this nurse and this doctor at 1,000,000%. Whether or not the licensing boards give a shit, whether or not they do anything, whether or not they investigate, whether or not they accept the complaint, whatever. At the end of the day, one thing I know for sure is true is that military veterans and service members oftentimes are way too quiet in reporting these types of issues to licensing boards. And licensing boards, sadly, are one of the only venues to expose this type of behavior, this unethical, illegal behavior that's happening in veteran affairs and military facilities across the country and beyond in some cases. And when they don't get exposed outside the system will just cover up for them to protect the system, to keep the money coming in from the taxpayers. And ultimately, they will continue to go on to create new victims in their patients in the future that are not military affiliated in many cases. There's a lot of examples of this that have happened. And when a report is made to the licensing board and they actually accept it and do their damn job and at least file it away at a minimum, then it does follow the provider. They have to report it to their medical malpractice insurance carrier. They can't hide it. If other patients come forward filing complaints, which oftentimes does happen, by the way, I've seen this, once they leave these government systems, the civilians are more likely to report a bad provider and unethical or illegal or behavior or bad service than a military affiliated person who, well, I think just from the military, a lot of people are just so beat down and used to abusive systems that they just take it, unfortunately. And then that's typically when they get more likely to get exposed, is when they end up dealing with civilian populations that actually have standards. And so it's important that, I've actually created a video about this on my YouTube channel, Woman Military Veteran. I've done posts about this as well, about reporting, how to report a provider at the VA, how to report a provider, and basic information. And so, it is the only option I know of to get it outside the VA to report this type of behavior. I know that there's lawyers that specialize in medical malpractice. Now they've made an entire living off of it, suing basically the federal facilities like the formerly Department of Defense, the Veterans Affairs, Veterans Health Administration, their doctors and whatnot, nurses, whoever. And they're constant. I understand there's, from what I heard of one of the people working Veterans Health Administration, these lawsuits are constantly incoming now because the issues are rampant. The issues are absolutely rampant. But it's a lot harder to deal with, to get my opinion, not a lawyer, not advice, okay? Go do your research. But in my opinion, it's a lot harder to, especially with the federal system, to get a lawsuit activated and successful, rammed through that system, than to file a licensing board complaint and at least get a track record. And for me, I'm not underneath any illusion I'm gonna get any health care from the system, that anybody's gonna help me, even though I filed a new congressional complaint, yay, another one, right? And I've gone through the White House, the formerly known White House hotline, complaint line for the VA and all this stuff. But what I do know is that the licensing board's complaints, if they're filed away, do follow that provider. So, you can mess with my health, you can try to kill off these veterans while you're collecting your check, but if the licensing board does their job, that is a way to create a track record to show, John Doe, Jane Doe, this date, this time, this patient X, stated this, provided this evidence about this, And then that's a record that follows that provider moving forward. So if there's any more complaints, there's now a record, a history. And that's really important, especially when you're dealing with the military population that is frequently being subjected to medical neglect. All right, so that's it for now.